Hi there, this is Dr. Tall Paul Simon, psychiatrist. Let's talk about bipolar. So, there's a lot of misinformation and good information out there about bipolar, but I'm here to try to dispel some myths. All right, so bipolar, it seems like the definition has broadened quite a bit over the past 20, 30 years. And I'll give you a little bit of insider tip. It's because of the drug companies. They want everybody to think they have bipolar. Why? So they can sell more drugs. All right. So back in the 90s and early aughts, a lot of these drug companies came out with good medications for bipolar. But the problem is, not a lot of people actually truly have bipolar. So only about 1, 2%. So what they did is they funded these different researchers and research chairs at these different institutions that to promote the broadening of the definition of bipolar. Now, a lot of people just think that bipolar seems to be anybody with mood swings or anger problems, and that's just not the case. So, bipolar is a term that's been around for quite a bit. It was one of the first mental health diagnoses back from the 1800s that was recognized. So bipolar, you think two poles, okay? So it is a good way to think about it. So one pole is depression and one pole is mania, okay? Or hypomania, which is a low level of mania, okay? So, but the curious thing is that if somebody has bipolar, they don't necessarily ever have to have depression, okay? So you can have bipolar and only really struggle with one pole of the bipolar. Okay, and that's the funny thing about it. Now, mania is really what defines bipolar. Okay, now there's two broad classes of bipolar. There's type 1 and type 2, and then there's everybody else who can't figure out exactly what's going on. So, the type 1 classic bipolar is diagnosed on the presence of mania. Okay, so mania is really an unusually high, intense up mood that brings on either a lot of anger, irritability, euphoria, like high mood, and people are talking a lot really fast and maybe not sleeping much. They just got tons of energy. And people around them are like, what is going on with this person? You know, this is not them. They are just really ramped up. People in mania tend to be really kind of pushy, uh, almost pompous jerks, and they just are on a kick, you know, to get something done and everybody out of their way. You know, they may be doing really stupid stuff, risky stuff that is not them. Maybe you know, being more flirtatious or running around or spending a lot more money than they would normally. Just doing risky stuff, and it's just not them. If now another key feature is sleep trouble. You know, they may not need to sleep as much, or they just have tons of energy and they can't sleep. They're just going, going, going. And that, if it's carried to extremes, they can actually become psychotic, start to really get paranoid, and start people really thinking that people are against them. And that's where it really can get even more dangerous because they really lose touch with reality if you're not sleeping for a few days at all. I mean, you know, so hallucinations and paranoia, like if somebody's on methamphetamine or something like that, you know, it can really seem, you know, bizarre and some scary, you know, to a lot of people. So bipolar mania can be obviously a real big issue. Now, bipolar type 2 is more prone to depression. So people really struggle with the low end of things. And the mania may not be noticeable at all. It's like hypomania, low level mania. So it may just be a little bit there, but not dramatic. People may think of that as normal for them. That's how they want to feel, perhaps. And anybody who's really experienced mania enjoys it usually. You know, a lot of people they do enjoy their mania. So when you try to treat them for that mania, "Oh, I don't want to be treated because I don't want to come down. You know, I mean, I'm flying high. Everybody out of my way. You know, I'm having a lot of fun here or something. So that's the problem with the mania side of it. Now, bipolar type 2 with the depression, it gets a little bit more tricky because antidepressants can often flip people into mania or just jumble up their mood and make it even more chaotic or not do anything. So with bipolar depression, it can be a little bit tricky. Now, there are some medications, very expensive ones, that are coming out for bipolar depression, but I find that if you can use a little bit of an antidepressant to get them out of that depression, but you really have to back off and focus on the mood stabilizers and really dial those in well. But sometimes just a low level of an antidepressant with mood stabilizer for bipolar 2 can keep people out of the woods as far as the depression. But you got to be careful with that. And that really ideally should be done by a psychiatrist because that's tough to do even for a psychiatrist to dial it in like that because everybody's different. So another key thing about mania, the diagnosis of mania or hypomania and bipolar, again, which is essential for the diagnosis of bipolar, it has to last a certain amount of time. Okay, and this is where a lot of people get hung up, is that they see somebody who has really intense mood swings all the time. You know, one minute they're fine, the next minute they're crying, the next minute they're losing their stuff, and blowing their stack or whatever. That is not bipolar. That's mood swings, okay? Mood lability or labile mood, we might call that. But it's not really bipolar per se, or it may not be. So it may be more of like a personality type. If they're always like that, if they're always just chaotic moods, you don't know what you're walking into any day or time of the day. So that may be more personality kind of stuff. It may respond to mood stabilizers, but it may be something like borderline personality disorder or something else. So you really got to look at the pattern to some degree of the mania or hypomania, what you're thinking of as mania. Okay, but typically that mania, hypomania is a more positive thing. People experience that a little bit, differently than just like chaotic. People with just labile moods, they don't like that. It's just chaos. So they really don't want that. So it's important to look at that pattern and see what's their baseline. And therapy, of course, is always important to try to help sort it out too. Okay, so we'll talk more about therapy and counseling and what that is in another video. Um, and we're not gonna. I don't want to get too much far into medications and stuff like that, But if you guys have other questions or things you want me to address, topics you want me to talk about briefly, just please mention in the comments. And you guys take care. All right, bye.